Hello everyone, my name is Ronnie Smith. I'm the Acting Director for the Ralph H. Johnson VA Medical Center. I wanted to give you a video update of the things we've been doing to be prepared for COVID and to protect our veterans and our staff. We've had a couple of significant changes since the last video update, so it was time to reach out to you and let you know what is happening. Just a general update, we are still continuing to work under modified operations. We continue to limit elective procedures and tests and operate with a no visitor policy, and we're still doing screenings at our entrances and giving each person a bracelet to make sure they've been screened before they come in. This includes temperature checks at the door, along with some screening questions related to signs and symptoms of COVID. To date, we've had a very low volume of positive veterans and for COVID and employees. So I do want to thank everyone for all the actions that have been taken in the community for the social distancing and self-quarantining to make sure that we're reducing the curve. It is making a huge difference, and we are seeing a lot less expected positive cases impacting us. Positive news for us is we now have in-house COVID testing available to us. It's a quick 1-hour test available in our laboratory. So those that we do need to screen that come into our ED, we're testing those before admission to our possible hospital. Well, it is a limited number of tests, so at this point we're only using it for possible inpatient admissions, so we know if someone's COVID positive or not before we enter the hospital, so we know the proper place to have our veteran. To date, we still have not had a positive inpatient at our medical center. But we expect one at some time in the future. A quick update on the status of PPE and supplies and donations. I do want to thank the community at large. We've had many reach out to us for PPE donations. We've also had a very steady supply from our vendors on PPE. So PPE for us has not been a concern. We've been able to supply our staff at the appropriate level, using basic conservation techniques, but for what we need, we're in a good shape and position. But I do also want to thank all our community partners that have been reaching out to us and offering donations to us. This week we also announced our partnership with VAMC for drive-up testing for veterans in the greater Charleston area. If someone has signs or symptoms, and they can call our tap line at the number provided on the screen for screening questions to check for signs and symptoms, and if it is appropriate, we'll be referred over to VAMC. Staff from VAMC would then contact you for possible testing, and then available to drive up. The location for the drive-up testings in the parking lot at the Citadel Mall over in West Ashley, so at the VAMC Health West Ashley Medical Pavilion. And that service is available Monday through Saturday. For our first day, we had 15 individuals that we identified that needed testing, and were called the next day and scheduled for testing on the same day. So it's a good start, and we're looking forward to having that available to our veterans and our staff going forward. In addition, we're now offering a drive-up pharmacy delivery as well. For those that are COVID positive or under suspicion of COVID, they can come to the medical center, and our pharmacy will deliver medications to the vehicle. This is available Monday through Friday from 7 to 6:30. We also have after-hour service where we'll provide a similar drop-off at our emergency department. Non-COVID patients can still pick up their medications at the pharmacy window, and then we still also have available our urgent delivery overnight and the usual medications that we deliver via our partnership with our VAC MOP. The next, we have moved our chemo infusion clinic to our Veterans Enrichment Center at another location on our campus. This is done so that we can take extra precautions to protect some of our most vulnerable patients that are often immune compromised while they go through infusion therapy. It's a very safe environment, and looking forward to being able to provide that service in a really great environment for our veterans. In addition, we're setting up a more robust triage process outside of our ED. We're going to be testing that starting this Friday, and we'll be moving to that model for those coming to the ED for additional triage. In the event we have an additional surge of COVID in our community, we'll be able to do in a safer environment where we can continue to maintain ED services for those that are both need treatment related to COVID, but also routine treatment that we see in our ED every single day. Lastly, I wanted to remind you that we are continuing to post updates on a regular basis through Facebook and Twitter, and also on our website, so please make sure to check those regularly for routine updates from us. And also I just want to remind you that although we're doing a lot of things to limit visitors to our facility and our community-based clinics and moving to a virtual care model where we're preventing to provide care, but through a virtual setting, we want to let you know we're still always available to our veterans. If you have any health concerns at any time, please feel free to reach out to your PAC team. They're here to support you, and the primary care team will work with you on whatever needs you may have. Also, you may also call the TAP line at the number provided anytime. If you need help, we're here to support you throughout the duration of our COVID response. That's all for today. I wanted to remind you to make sure you continue to wash your hands with soap and water regularly, and continue doing that social distancing. We thank you, and thank you for your support, and we're continuing to be here for our veterans. Have a good day.